Good morning to you. And today, being a Wednesday, we always have a doctor.
Yes.
Of course, from the past few weeks, we've had gynecologists. We've had
TCM.
TCM.
That was fun.
We have
ENT.
Yes. Very
That
soon, we're
one-
going to have gastro doctors as
That
well.
one was dedicated to you for ENT.
For the snoring.
So
okay.
I feel like how many doctors can we get to address Gerald's problems? Today is another
as many
one.
as possible so that I
We
can be
got
Superman.
Dr. Nijam Latiff. He is from T32 Dental Group. We got a dentist in the house. Welcome.
Dr.
Thank you. Hi, Gerald. Hi, Sophie. It's a pleasure to be here. Thanks for having me.
We were just saying earlier off air, Dr. Nijam has the nicest voice,
Yeah, that's right.
the calmest voice, and
you.
he's wearing his scrubs. Unfortunately, today you can't see him, but what you can do is you can WhatsApp us and send in your dental questions.
Oh, yes.
He knows a lot. And we were talking off air about how you got into this, and you have a funny story because you were saying how initially dentistry was something that you thought was boring. You weren't going to go down that route, but then
Yeah, because all we grew up thinking about, I grew up watching like medical drama, right? Like
Yeah.
ER and things like that. And we want to be that, that surgeon in scrubs, right?
Yeah.
Walking in.
I watched Grey's Anatomy. I wanted to be McDreamy.
Yeah, and nobody wants to hold the toothbrush and dentistry seemed very boring. And the first 2 years of dentistry, the subjects were not, the best. I preferred the medical subjects. But I think in third year and fourth year, when you actually start seeing patients and actually, working in the mouth, you gain a much more greater perspective. And I never looked back since then.
And you're saying that, being a dentist is not just, like the mechanical work. It's got to do with the chats with the patients,
100%,
to understand them more. Because every time, okay, I'm talking about dentists from many, many years ago. When I was really young, when I was like 5 or 6, when I go and see the dentist, that dentist was very unfriendly. So it gave me the impression that, oh my gosh, I'm going to go to this person who's going to be so unfriendly with me and I'm scared.
Yeah.
So you're saying that as a dentist, you need to break the ice,
100%,
talk to
because
them.
it is a scary experience. I mean, you're lying down, there's bright lights, there's water in your mouth, there's loud sounds. It is a very scary experience for everyone. And even when I'm sitting on the chair and getting my teeth treated, it's still a scary experience, no matter whether you're in industry or not.
Yeah.
So it is just a very scary experience. And what's worse is if you have a doctor who doesn't explain things properly to you or is not patient enough, then you start to develop a phobia,
Right.
Especially with kids. So you want to be really careful with kids because you don't want them to develop a phobia and then they never want to see a dentist.
Yes.
And that's why some people for many years they just don't see a dentist unless they really have to.
Right.
Yeah.
So
Eh.
and yeah.
Don't mind. Stupid question incoming.
Okay.
Can a dentist actually do their own teeth?
Nope. I've
Okay,
tried.
no. Okay, can.
See, I can imagine Gerald these are the questions that pop into his brain. And this is like asking a aesthetic doctor, are you injecting your own face?
That one I think can. No? Okay,
Gerald,
maybe not. Okay, no.
So you're saying, of course, you can't. You have your own dentist.
Yeah,
Is it one of
that's
your
right.
friends?
Exactly. My colleagues. Yeah, my
Okay,
friends. Yes,
so you're
that's
like,
right.
Glenda, are you free for a second? You mind coming and checking this out, or do you
Yes.
schedule it in?
No, we have to schedule it.
Oh,
yes, we
okay,
have to
okay,
schedule
just
it,
checking.
Yes.
Yeah. Of course, from T32.
Yes, T32.
Go
Yes,
check them out.
And also, Gerald's got new hope for doing his veneers. We've been asking him so many questions behind the scenes. I think he's probably sick of talking to us already. But we've got some questions on WhatsApp.
Okay,
Can I get to
okay,
those?
let's go.
Okay?
Sure, yeah.
Let's go.
Okay, Monica says, I have a really bad phobia of going to the dentist to sit on the chair because I feel like I can't breathe. Is there a way to overcome this, doctor?
Could it be because of a lot of water getting into the mouth? So usually what we'll do is that we can give, for some people who have problems breathing, we actually give them lots of breaks in between. Maybe we might raise the chair a little bit higher. But yeah, if it's just on the dental chair, there's lots of things that we can do. But if they constantly have difficulty breathing, then they could have like a narrow jaw or narrow palate. And there's some dental interventions that we can do to actually widen that up. So we see people who snore, who have difficulty breathing at night. They do a lot of loud breathing, even for children as well. They breathe very heavily. And there's certain exercises that we teach them, and there's certain things that we can do to widen up the jaw for them to actually breathe a lot better.
So it's incredibly 360. It's not just teeth and the things that you see. It's not just about confidence. It's also about your health, right? We have another question.
Before you go to the next question, what was it for me when it comes to like what scares me at the dental chair? Is the sound. The
And that's not just the dentist going, hee.
So there was one time I went to my daughter's dentist, pediatric dentist, and then there's like a TV on top. That was when I felt like I was a little bit more at ease.
I think a lot of them have these TV screens. Wow, you're like a child. I can't believe it. Okay, someone else says, hey, doctor, I don't smoke or drink coffee at all. I brush my teeth twice a day, but my teeth are still, they have a yellow tinge. Why is that?
Yes, so sometimes as we get older, the enamel, which is the outer layer, sometimes gets thinned down. And then it shows the underneath layer, which is the dentine. So the dentine is usually a little bit more yellow. So that's kind of shows up. So as we get older, naturally our teeth does get more yellow from either to all the coffee and the food stains that we take, or it could be just natural aging, and that makes our teeth look more yellow.
How do we dress up dentine?
Yeah, so that's so if you, for some of my patients who grind their teeth at night, that dentine shows up very, very quickly. So even if they're not very old, they're like in their 30s and 40s, you can actually start to see that coming show through. And that's a bit of a concern because the next layer is actually the nerve of the tooth.
Oh my.
So once you get into the nerve, that's where it becomes really painful. So you want to do whatever you can to actually protect that. So we actually built the teeth up. So whatever, it's just like, imagine, I always use this analogy in my clinic, like driving your car. If the tires kind of get worn down, you want to change the tires before it gets to the rim.
So how?
The metal. So we actually build the teeth up. So we have different materials that we can use to kind of build the teeth up
You can
again.
putty the teeth.
Well, I want to go into your clinic tomorrow. One more question as well. Good morning, guys. I have a question for our lovely dentist. My nephew, he's 7. Okay. His milk tooth dropped, but it's been more than a month. No sign of the new tooth. What's going on?
Yeah, so 7 is a good age to kind of take an X-ray to just see where the teeth are. I wouldn't be alarmed because sometimes the teeth just takes a little bit longer. So usually we'll give it 6 months, maybe even a year to see that if it's coming through. But it's a good idea to see a dentist, get an X-ray done just to see where the adult teeth are. It's a good assessment. You don't have to take X-rays all the time. 7 is a good age. 9 is a good age to take, and maybe at 12 you can take another X-ray. That will be good enough.
Wow, very interesting.
Can I just say also that Dr. Nijam has got a very good voice?
Thank you,
sorry.
Thank you.
Besides the point.
Okay, he's a dentist.
Yes.
We're gonna come back and ask him to rate procedures. Okay, we want you to rate some procedures for us. Okay, so if you're listening in and you're wondering about these, this is a great time to learn something. Okay, so veneers, rate them, please.
10 for the right person, 1 for the wrong person. You need to get the right person to do that.
What's the wrong person?
So there's 2 aspects. So for the patient, if your teeth are not well aligned and if your teeth are not healthy, you've got cavities, you're not the right person to do veneers. You need to work with the right dentist and the right team as well, because nowadays with veneers, you can actually do it without preparing the teeth as much. So you don't want to cut the teeth down. We do hear some horror stories where patients go and they see a dentist and they get their teeth ground down to a stump and then they get the whitest of whitest and it looks so very, very artificial. So you want to find the right dentist, the right ceramist to work with so that you get a very natural look. So it has to be very customized. So you don't want, for some people, they want to walk into the room and show off their smile. So for those people, we go for a lighter color. But there are a lot of people who want it to be very subtle.
Natural,
they don't want it. They want it to look very natural. And then we can actually choose a color that suits them, the shape and the size that actually complements their facial features. So,
This is so tempting. Are you tempted?
Yeah, I am, but are there people who would come in and say, I want the whitest of white?
there are, but even then, so we again, we don't go toilet bowl white.
Wait, so have you ever said, but that's what I want, and then you would advise possibly against it?
I would against it, and we'll show them. So you get to test. So the good thing about veneers is that you get to kind of test drive it first. We show them a preview. We show them the whitest of white, and if they're really happy with it, then I have to do what they want.
But do you say I'll do it? But just don't tell them you came to me.
Write a disclaimer and say it's not done by me.
I didn't suggest this. Okay, I want to go now onto whitening. Rate it for us, doctor.
Oh, I think it's 9 out of 10 or 10 out of 10 because it's very safe. It's a very safe procedure. It's very conservative. It's reversible. So you're not doing any harm to the teeth. For some people, they might get a little bit of sensitivity, but that's always reversible. I mean, it goes away. If you stop using the whitening gels for some time, it goes away.
Wow.
So it's very, very safe. So it's a good way to start. If you're exploring cosmetic dentistry, whitening is always a good place to start.
Wow, let's explore it. Okay, now this one is, I'm usually scared to go to the dentist, and now I'm like, yeah, bring it on. Okay, how about this one? Scaling, so teeth cleaning, once a month.
Once a month. Wow. I think it's a bit excessive. You don't really need to do it once a month. I think 4 to 6 months is a good range.
Okay.
What we're really looking for is we're reducing the bacteria in the mouth, right? So you've got good bacteria, you've got harmful bacteria. Why we want to see patients often, not too often, once a month is a little bit too often, is because we want to get more of the good bacteria in the mouth. So there's a lot of research that talks about the mouth-gut relationship. So whatever bacteria, if you have a lot of harmful bacteria in the mouth, it doesn't just stay in the mouth. It gets into the bloodstream. It can also lead to things like diabetes, cardiovascular disease, as well as Alzheimer's disease.
Oh,
mental
so
health.
it's all linked, because I wear a
It's all
mouth guard
linked.
at night and I have a special cleaning tool for it and a special tablet that I use to disinfect it regularly.
Yeah.
So is that the right thing to do?
That is the right thing to do. Yes.
Wow,
Well
go see a
done.
dentist today, man. I mean, now I've found out so many things that you need to prep yourself and literally just save yourself from all the problems that could arise in the future, right?
I can't wait to see your teeth next month. Wow.
We got a couple of questions coming in. Where can we find this guy?
Yeah, we want him specifically. T32 Dental Group. He's at Camden, but he's also at Raffles Place.
That's right.
So they
Camden
have
yes, that's
two
right.
arms, and he's obviously splitting his time. He doesn't have a twin, okay? So you can meet with Dr. Nijam, and I just want to, before we go, address a couple of your questions, okay? Someone is saying, I'm curious about the procedure to remove old veneers and replace them with better ones. Can you touch on that a little bit?
Yeah, so we actually can remove the veneers. We can use lasers to actually remove the veneers in a very safe, effective way.
Precise way also?
Precise way,
Wow.
and we can put new veneers on, yes.
Oh, because last
technology.
time I heard after you put on, right, it's there forever.
Yeah, I mean, veneers are meant to last for a long time. You don't want to be doing them, every now and then. So when we do a veneer procedure, we want it to last for the longest amount of time.
Okay.
But after some time, maybe you want to change the color, maybe you want a different look, and we can actually change that for you.
How about dentures? Nobody does that anymore?
Of course, yeah, we do. We do dentures. My colleagues do more dentures than myself. I tend to focus more on other areas of dentistry. But yeah, dentures, really nice way to, if you have lost tooth, there's so many different ways of replacing teeth. Dentures by far is one of the most economical way to replacing teeth.
And has that advanced from the many years before?
It has. But the thing is that now with implants is always... It's always nicer to have something that feels almost as natural. I mean, to be honest, nothing really feels as good as your natural teeth. So you want to maintain that as long as possible. But if you need something, the closest would be a dental implant.
Okay.
Okay, and lastly, someone's saying, look, I've got a lot of frequent bleeding gums and infections. What am I doing wrong?
Well, the thing is, bleeding gums can be it's just a symptom, right? So it could be mouth breathing. It could be bleeding gums because of hygiene issues.
Like gum disease.
Gum disease.
Okay.
It could be even a sign of poor gut health.
Oh,
right. So that's why. So in terms of dentistry, it's evolved so much that the mouth is like a gateway for your overall health. So when we look into your mouth, we can tell how great your sleep quality is, what kind of inflammation you have in your body. So,
Now I'm scared.
so if you have bleeding gums, it's a sign of inflammation in your body.
Okay.
And how much of inflammation you have can affect you in so many ways, from developing systemic conditions like what we mentioned, like cardiovascular disease, diabetes. It can even put you at higher risk of getting cognitive diseases like Alzheimer's and so on.
You know the Japanese, right? They every time they come home from outside, they rinse their mouth with salt water.
Yeah.
Does that help?
I think there's a really good way. Another one, the traditional way is oil pulling, which is really amazing as well. So salt water rinses, oil pulling, they're really good.
Oil pulling, what does that
Traditional
mean?
ways, oil pulling. So the coconut oil.
And you gargle with
you
it.
swirl it around. People do it every morning.
Wow.
It's a really good way to kind of remove some of the toxins in your mouth.
Gerald, calm down.
I'm going to mix coconut with salt. No,
Oh my God, you're so excessive. Dr. Nijam, thank you so much. We have learned so much from you. We can't wait to have you
It's
back on
been
the
a
show.
pleasure,
Thank
Sophie
you.
and Gerald. Thank you so much.